Beauty Diaries.
Hello and welcome to Beauty Diaries. The in thing in the beauty industry for some time now or way back is plastic surgery. A lot of people have been shamed about going through, the process of increasing their butt, their boobs, reducing their waistline. But in all of this, it is all about beauty. Today on the program, we'll be talking to a plastic surgeon who will be giving us some information on why one should go under the knife, if need be, or have your fat sucked out from the different areas of your body. And we'll get to know some other things, aside liposuction and tummy tuck. We'll get to know some other things about beauty surgery. Now, please note on this program that whatever we're bringing to you today, because it's a medical information, it is not a consultation. You need to do more work, go to a surgeon, and get some consultation. You're welcome to Beauty Diaries. I am Namure Etoemioya.
Beauty Diaries.
You're welcome back. With me on the program today is Dr. Tonge Malo. Am I correct?
You got the name right.
Hey! Okay, like I told you earlier, Dr. Malu is a consultant plastic surgeon, and we'll be learning a lot from all the research we've done. For some of us that have just, we just sit down and assume. So it's good to have a professional with us today, talking to us and telling us the right things about plastic surgery.
Sure.
Now, you know very well in Nigeria now, gradually it has become, if I may use the term, the in thing. People are conscious of their shapes, body type, and their health. So tell us, why plastic surgery?
Very good question. Actually, I would say humanity as a whole, or right from inception, people try to look better. And as time has gone on, there have been better ways of achieving that. I mean, if you look at our grandparents, our parents, you see that they have some tattoos around their bodies, some markings on the face. They are all forms of plastic surgery because it's all a desire to look better.
Okay.
And the definition of beauty by cultures, individuals, tries to push them to go for plastic surgery. So over time, plastic surgery has evolved to more significant interventions where you can virtually not just do markings or paintings or some form of makeup, but you can actually take out some parts of the body that you don't like or put in some parts of the body that you like. So it's actually our culture as human beings. Plastic surgery is actually a culture of human beings. And you made a very important statement that in Nigeria is becoming the in thing. That's actually been the in thing all the while.
Okay.
It's just that people now see that, okay, it can be done here and it can be done better. So,
and people are not dying.
And
It is safe. But that's for you to tell us.
Yes.
Okay.
Yeah.
Now, there are different types. Let's go into the different types of plastic surgery.
Yes. Yeah, as for every part of the body, as I said, it's about humanity's desire to look better.
Yeah.
And it's a God-given desire in every human being to look better. Physically, first, emotionally, psychologically, and other areas. Now, any part of the body can be made better. From the face, you have facelift, you have fillers for the face, you have nose surgeries that are called rhinoplasties, you have blepharoplasties for people that have eye bags. They can actually look better. Then, correction of the eye bags can be done. For people that their cheeks are too big, they can have their buccal cheeks reduced.
That's good.
For people that their chins are shorter, they can have elongation of the chin. And the opposite is also true. There are people that have lost so much fat on their faces that want fat to be transferred to the face, so you can have fat transfer. It's what we do on a regular basis. You can have fat transfer to the face as well. If you come to the trunk, you have people taking out fat from their tummies, their back, in order to enhance the curves that they already have. If you go to the butt, people can actually add fat to the butt or take out fat from the butt, as the case may be. Same for the hips. And the breast, you have people that can actually make their breast bigger or make it smaller.
Okay.
There are people that actually have very large breasts. And it causes a lot of
Back
backache,
pain.
it causes a lot of discomfort for them, apart from the aesthetic appearance. And you can have the breast reduced. Then there are people who have actually had surgery, maybe for breast cancer, and the breast had to be removed. They actually need a new breast. Now that is what you call, you have to reconstruct the breast ab initio, either from the person's body or using implants. So there are different options for different parts of the body. Virtually every part of the body, from the hair down to the feet, can actually be improved.
Yeah, we have hair
in plastic
transplants
surgery. You
as
have hair
well.
transplant as well. If you don't want to go for the surgical aspect, there are injections right now that improve hair growth. And all these things are possibilities. It's actually it's a variety of possibilities when it comes to plastic surgery. That's even why I made a choice for plastic surgery.
So you can transform.
So that if the variety is too much, I mean, it's just so good. Life is full of variety, and any part of your body you don't like, actually make it look better.
I was so eager to go into the topic, and I didn't ask for your background. So let's it's okay, we're gisting. So let's come back to how you became, a plastic surgeon.
Okay, it's a long story, I would say.
First
of all, I always wanted to be a doctor because
Okay.
my uncle who raised me is a professor of medicine, and I always looked up to him. So when I became a medical doctor, I now decided that, okay, what am I going to do that will give me time, that will not get me bored, that will also help me improve, make people happy? Because I don't just want to treat people who are sick. I want to treat people who are not sick, they want to look better. And that pushed me to the side of plastic surgery. So before you become a plastic surgeon, you must have had the undergraduate training to become a medical doctor, which takes about 6 years.
Yes.
That is if you don't add the strikes and all that. Mine had the strikes added, so I spent
Which
7.5 years. I finished from University of Jos.
Okay.
Yes, about 15 years ago.
Okay.
So after that, you now take another course, is a postgraduate training to become a plastic surgeon. That means that you have to train for another 6 years to become a plastic surgeon. And then, of course, you can do other additional trainings. That's the little story about becoming a plastic surgeon. Yeah.
Interesting.
Yeah.
Now, I want to go into details of some things, precautions.
Yeah.
Precautions when going into plastic,
Surgery.
when having a surgery.
Yeah.
Okay, be it lipo, tummy
talk, yeah,
all
good.
of that. What is the process? Now this is consultation
yes,
time.
This is beautiful. The biggest step in
Yes.
taking, and I also call it a safety, the biggest safety step is to choose the right doctor. It's the most important thing. I tell all my clients that the most important step in your surgery is the consultation. You have to be sure that you are meeting a qualified plastic surgeon. Because just like in any other field, you have quacks in plastic surgery. In every field you have them. But you have to make sure that you are meeting a qualified plastic surgeon, a person who is trained to be a plastic surgeon. Because not anybody should handle your body. You can be botched for life. Apart from the risk, death is just the least on the line, because people die from appendix surgeries on a daily basis, they die from other things on a daily basis. In fact, people die from other causes more than from plastic surgery. But it's about your body. This is your confidence. People who come for plastic surgery come there because they want to get back their confidence. They want to look better.
Yeah.
Now, you can get worse if you don't make the right choice in choosing the right person to do your surgery. So I consider consultation as the most important step towards this. At consultation, every trained plastic surgeon will assess their clients to know first, are you fit for the surgery in the first place? If you are fit for the surgery, what are the options that are available for you? What are the best options? People always have a picture in their mind when they come for consultation. They always have a picture in their mind. Now, is that picture realistic or is not realistic? If it's realistic, fine, let's go. But if it's not realistic, it's the duty of the surgeon to counsel you on the better options that are available for that same thing that you want. In many situations, I've told people, look, this is what you want, but that's not what you need. Some people come, they need a tummy tuck, they say, no, I don't want anything relating to a knife, I just want fat taken out. That's if you take out fat, it will not give you the result you want. So the surgeon plays that role during a consultation. After the consultation, you usually be subjected to a series of medical tests to ensure that you are still fit. The consultation is the most important, and it leads to the other things. After that, then you can now progress to have your surgery. After the surgery, there are instructions you are supposed to follow, and the doctor will also guide you on those instructions you have to follow. This is a summary of what goes on for plastic
I
surgery.
know you don't want to tell me everything because...
No, I will be glad to tell you, but of course, you need to pay a consultation.
That's why I was going, you see? And anyway, it's fine. Yeah. Now, the fears of having
plastic surgery.
Before and after especially.
Yeah.
The thoughts of, will I die? Will the wound open or the stitch open? What will, do I have to do it again? What if it goes bad? These are thoughts from different women, men, generally. So I'm sure people will want to know the things to do or to prepare their mind anyhow when it comes to after the surgery. We'll be talking to you again after the break, okay? So do stay with us. We'll go back after the break.
Beauty Diaries.
Even if you're a size 2, there are clothes you wear. You need a body shaper. There is a fit it gives, that ordinarily if you're not wearing a body shaper, it just looks shabby, and all that. So body shapers are very important. The bra you wear is very important. It brings out, there's what it also does to the clothes you wear. So undergarments are also very important in styling. There are fabrics that a plus size shouldn't even wear at all, except maybe like a t-shirt fabric, especially you're wearing a t-shirt on top. So you see some plus size people who wear t-shirts all the way down and go to work. That is a no-no.
When you say t-shirt all the way down?
Like, that's the fabric.
The t-shirt fabric.
The t-shirt fabric.
Like a jersey?
Like a jersey, and then they have it all the way. They have them in gowns, and then you wear that to work. Everything is going to be showing. And it's not appropriate. There is a dressing for the workplace. There's a dressing for a day, you're just going for a day thing, like this is a day thing, There's a dressing for night, and then there's a dressing for a party. Some people, don't know when to wear the party, and then when to wear the day, and all of that, and then just mix up everything.
Beauty Diaries.
You're welcome back. Now we're talking about the fears of plastic surgery before and after.
Yeah.
I would like to use myself as an example.
Very good. Practical.
Yes. Okay, I tell my friends, okay, I've always had a big tummy right from, childhood. I look forward to having, of course, a flat tummy.
Yeah.
I want to tuck in my t-shirts and all of that. But I'm scared, okay? What will happen? Because, of course, there's been some bad cases we read about, somebody dying, or the veins, there's something...
Blood formation, something to the lungs and all that.
You know everything. So, doctor, please tell me.
Well, I would say that concerns about plastic surgery are exaggerated. They are really exaggerated. Because overall, if you take statistics, plastic surgery procedures are the safest. And the reason is simple. It is usually done in people who are healthy. People die from appendix on a daily basis. You don't hear that noise about it. People die from going for typhoid surgery. People die for all kinds of surgery. Surgeries as small as removing a lipoma, people die from it on a daily basis. So every surgery has its own risk. But I dare to say that plastic surgery procedures have one of the least risk. But because it has to do with beauty and aesthetics, once you have one case of a complication, it's noised abroad. But the reality is that people have plastic surgery procedures done thousands every day across the world, and they are very safe. But going back to what I said, the fears, I think, are born out of ignorance. I think the information is getting across thanks to AIT now. And more people know that it's actually safe. There are risks for every procedure. If you do a proper consultation with a specialist, in 99% of cases, the specialist will be able to pick out what are the likely risks that every individual has.
Yeah, like if you have high blood pressure.
Yes, we have high blood pressure.
If you have some disease that may affect you during the surgery.
Exactly. Those things are picked very early. plastic surgeon is trained to pick them up very early. And most of them can be corrected. For those that cannot be corrected, he will usually cancel the surgery. I've had people come to me that they want surgery, and in the process I tell them, look, because of this and this, you have to delay your procedure. If you cannot delay the procedure, I will not do your surgery. That is where the training comes in. How can you know who is at a higher risk than other? But overall, most people want to do surgery. People who are healthy, they are not born, they don't have a liver problem, they don't have a kidney. If you have a liver problem, your problem is not surgery. Your problem is how to sort out that liver problem. If you have a kidney problem, you are thinking about, oh my God, how am I going to survive for the next 1 or 2 years? Those are not the people that come for plastic surgery. It's healthy looking people like you. And most times, their biggest problem is just what they want to correct.
Yes.
Most of their organs are functioning very well. Most of them are young people, you understand, to middle-aged, they are healthy, they don't have most of the life-threatening things. But the other side of it is that people don't know that plastic surgery is actually a treatment for a lot of problems. It actually improves lifestyle.
True.
People who are morbidly obese find it difficult to walk around, they get tired easily and all that. They are at higher risk of diabetes, they are at higher risk of hypertension, they are at higher risk of dying. Now, taking out fat is actually a treatment for some of those conditions. I've had people who are diabetics, and after liposuction, their blood sugar was better controlled.
Yes.
And it is a documented fact that fat removal is actually a treatment for people that have a blood sugar that is intractable, that is so difficult to correct. So surgery, plastic surgery is not necessarily just aesthetic. It also has a therapeutic purpose, as I'm telling you. So I would say that as much as because of ignorance, the fear is there, but those who come around know that actually there's no need to be afraid. And if you're afraid, you should talk to a doctor. By the time you talk to a plastic surgeon, most of the fears actually disappear.
You get counseling and know what to do.
Yes.
Now, healing process.
Yes.
Liposuction is removal of the fat from the
Any
different
part of the
areas.
body,
After removing the fat from, for instance, the stomach area, does it go back?
Yeah. What happens in fat is this. Fat, when people add fat, most times they don't actually add new fat cells. It is the fat cells that are there that actually grow bigger. The beauty of liposuction is that it reduces the number of those fat cells. So if you have, let's say, 1,000 fat cells, liposuction may take out, it doesn't take out 100% because you need fat also to survive. It may take out about, out of this 1,000, it takes about 600 or 700. So you have like 300 fat cells left. Now, those fat cells, the chances of them getting bigger to the level that 1,000 cells would have gotten bigger is less. So after a liposuction, the tendency is that people hardly add fat in the areas that liposuction has taken place. Okay. But if they don't control their diet, they don't live a healthy lifestyle, they will definitely add fat. But the fat goes to easier areas. It goes to other parts of the body that the liposuction did not take place. So if somebody does a liposuction of the tummy and the back and the arms, when they are adding fat, good enough, the fat will first go to the butt. So the fat will first go to the butt. And so it may be a good thing, that the fat is not going to the butt to make the butt bigger. People didn't do a fat transfer, just did a liposuction of their body. They discovered that after some time their butt is looking bigger. It's because the fat they are adding is actually going there. But the other side of it is that the fat can also go to the face. So we tell people that liposuction is not a weight control procedure. It's an aesthetic procedure. It's for you to look good. So after you've done your liposuction, you should live a healthy lifestyle so that you maintain what you have gotten with plenty money and plenty discomfort. It costs a lot of money actually to do liposuction.
Now, tummy talk.
Yes.
Most women want to know, at what age can I have a tummy talk? If I have not had, if I do not have children now, can I have a tummy talk? Will I be able to push or have a CS?
Good question. Incidentally, people need to understand the difference between tummy talk and liposuction.
There is also abdominoplasty.
The tummy talk is the same as abdominoplasty.
It's just a term.
Yes, it's a term. A layman will call it tummy talk.
Okay.
The professional can call it abdominoplasty. And the word abdominoplasty actually explains tummy talk. Abdominoplasty means that there's a correction, a plastic surgery of the abdomen. And what happens is that after several kids, usually, the muscles that protect the intestines and everything get weaker and they pull apart. So during a tummy tuck, after opening up the skin and the fat, we reach the muscle layer and the muscles are repaired, they are brought together. That's the plastic. Then the excess skin is actually trimmed and the skin pulled out. So you see, we don't enter the abdomen. There's no, plastic surgeons don't work in the kidneys, we don't work in the womb, we don't go near them. They are all far away from our reach. So people can actually get pregnant after a tummy tuck. In the same way that people can get pregnant after liposuction, we don't work in the abdominal area. We just want to correct this. But for tummy tuck, because of the weakness that has gotten there because of several pregnancies, we advise people to give at least 2 years before they can take it, so that it doesn't worsen the weakness after the correction.
Oh, okay.
Yes.
2 years.
Yes, at least 2 years. But many people get pregnant after a tummy tuck. So, but the whole thing is that the layman's understanding of surgery in the tummy, it will affect pregnancy, it's not like that.
Okay.
Liposuction, tummy tuck, none of them gets to the womb or gets to the abdominal organs.
Beauty Diaries.
You're welcome back. Now we're talking about butts and butts. When we just started with this business of being beautiful, looking good, a lot of us were wearing padded bras and padded panties. And over time, some people will say, that's not hers, that's hers. But, you know, we started with plastic surgery and everybody's, you have to, you know, you want to check, is it hers? Did she do something? You know, there are some that are stiff, there are some that's soft. Talking about the butts now. Doctor, why is this so? And the fat that is injected into the butt, over time, is there a problem? Because people really want to know.
That's a very good question. So you're talking of the butt or the boobs or both?
Both.
Okay, now let's start with the butt. Now, fat transferred to the butt and to the hips is the person's fat that is taken and transferred to the butt. So it's just like moving locations for the fat. What happens is that the fat is alive when it is moved, and it is expected to get a new blood supply where it is taken to. So it's part of your body, and it can grow like the other fat cells grow. That's why for those that it is done so much, you can see that after time it becomes even much bigger because the fat cells grow. They are alive. It's part of the body. It's not like cement where you put and it's static. But so it's expected initially after fat transfer for the first few weeks, it can be hard because the body is trying to heal and the new cells are just trying to find their bearing in the new location. But after some time, several weeks and more, it gets soft because it's fat. Fat is fat. But some people's skin is naturally tough. So even if they have a fat transfer, it will appear as if it's tough. Some people's butt, since they were born, is very hard. So there's nothing you're going to change about that. It's the texture of their skin. It has little or nothing to do with the fat. That's why it's hard. The same thing for the breast. Now, fat transfer to the breast is a possibility also. But as I said, it's not everybody that qualifies for that. Because if you have drooping breast, then I would advise that what you need is a breast lift. Even though you can have a breast lift and fat transfer to the breast in the same way. Fat transfer to the breast is to increase volume. Breast lift is to lift up the breast as it is. So, and then of course there are other options available for the breast. For people that have a very small breast and they want it bigger, they can use implants. Breast implants are very, very safe. And they can be there for 10 years, 20 years, as the case be. Yeah,
what if one has an accident?
Nothing happens. The breast implants are very, very strong.
Burst.
They are made to be very resilient.
Oh, wow.
They are made of silicone. The commonest of them are made of silicone. I hear stories of people going in planes and then maybe at a particular height.
Yes, that one.
The pressure. These are not true stories. Social media is not real. You can virtually punch the breast implant and it will not bust.
I hope you've enjoyed today's episode of the program. We're bringing you a series of body confidence. And from what you heard from Dr. Mali, we'll be taking it a step further by talking to some other people. So if you're interested, if you had a surgery done and you want to come on television, we'll be willing and happy to have you on the program. Aside that, if you are still battling with your conscience, battling with should I do it or not, I believe also that we've been able to give you some information and you can decide now on what you want to do. Please know that the program we've had today is not a consultation program. There is more to it. You need to go to a doctor. So Beauty Diaries will not be held responsible if you just assume, take everything here and say, yes, this is it. Please, we are not an authority over plastic surgery. Go ahead, go to a plastic surgeon and do your consultations, okay? So that's it for now. We'll be bringing you another episode of Body Confidence. I want to say thank you for being part of the program and remain beautiful inside and out. I am Namuri. Bye for now.